Applying the PICO 7Y single-use negative pressure wound therapy system after bilateral breast surgery. Introduction. The PICO portfolio offers unique single-use negative pressure wound therapy that helps improve both wound closure and surgical site complication rates. The PICO portfolio manages low to moderate levels of exudate while providing compression-like therapy to the wound or incision, wound margin, and peri-wound area. It's canister-free, portable, and splash-proof, which can help improve patient mobility and increase satisfaction rates. The PICO system is the first FDA-cleared device to provide 7 and 14 days of pump wear time for a wide range of indications, including acute, chronic, and traumatic wounds, subacute and dehisced wounds, closed surgical incisions, flaps and grafts, and partial thickness burns. PICO portfolio dressings have a proprietary 4-layer structure for optimal exudate management in both open wounds and closed surgical incisions, with our patented airlock technology layer that helps distribute negative pressure evenly across the entire surface area of the dressing. The PICO system meets a variety of needs, with options that offer pump duration of up to 14 days, various dressing sizes, and the ability to treat 2 wounds or incisions simultaneously. Components. Now let's take a closer look at the PICO kit's sterile components. Unlike other systems, everything you need is included in the kit, so you never have to search for supplies when you're ready to apply. Application overview. PICO 7Y is engineered for an easy, accurate application. Remember, PICO dressing should only be applied, changed, or removed by a healthcare professional. First, let's review some important information about fit and placement. PICO 7Y can be used on closed incisions or wounds up to 2 centimeters deep. With low to moderate exudate levels, that means approximately 300 milliliters of fluid over the course of a week. PICO dressings should be used on closed incisions or wounds that fit comfortably within the area of the pad. Breast application. Now let's see how PICO 7Y is applied after bilateral breast surgery. Clean and prepare the incision according to your local protocol. Using a sterile technique, peel the backing plastic pieces from one side of the dressing and place centrally over the incision. The dressing can be placed either vertically or horizontally. The soft port should be above the incision, on intact skin, and not extending over the incision. PICO may be used in conjunction with surgical drains, provided the dressing is not placed over tubing where it exits the skin. Place dressing approximately 1 inch away from the drains, with the port position uppermost from the incision. Make sure the dressing lies flat to the incision and the surrounding skin. Remove the remaining backing plastic and smooth the dressing around the incision to prevent creasing. Adjust the placement as needed to eliminate any creases. The silicone border, but not the dressing, may be cut to work around drains. Once the first dressing is in place, insert the batteries in the pump's battery compartment as shown. Once the batteries are installed, all 4 indicators should illuminate for 3 seconds. Replace the cover. Join the pump and first dressing by twisting together the connectors. An application tip to help achieve negative pressure is to place a finger over the opposite port while pressing the orange button. The green OK indicator and the orange leak indicator will start flashing together. This tells you that the pump is working to establish negative pressure, while a buzzing sound will tell you it is working to achieve a seal. Once a seal has been achieved, join the pump to the second dressing. Depending on the size of the incisions, the pump can take up to 100 seconds to reach the intended pressure level. Once therapy begins, only the OK indicator will remain flashing. The dressings will compress and should be firm to the touch with a raisin-like appearance. Instruct the patient that the dressing full indicator will flash routinely every 24 hours as a reminder to check the condition of the dressing. If no dressing change is required, refresh the device by pressing the orange button twice. If the pump is unable to establish negative pressure, only the orange leak indicator will remain flashing. Follow the troubleshooting instructions for eliminating leaks and blockages. Apply the fixation strips all the way around the dressing so they overlap the border by approximately 1 centimeter. Remove the printed top layer after you've applied each strip. Make sure the tubing isn't twisted or trapped by clothing. Use the included clip to attach the pump to clothing as needed. This system is designed to allow patients to continue with their daily activities as appropriate. Change dressing in line with standard incision management guidelines, typically every 7 days depending on exudate levels. With a canister-free, patient-friendly design, the PICO system offers a unique solution for single-use negative pressure wound therapy. Experience the power, convenience, and versatility of the entire PICO portfolio system.